We have tried very hard to build metrics. We started off with what the White House Reopening America plan recommended, and then we customized it for Idaho based on the data that we get and our ability to analyze it in a timely manner. So you'll see that's the basis of it. The starting point is to look at just how widespread is the virus, what are we seeing? And you'll see at the top there the number of cases by the date that it was reported to us. You can see there that we talk about a downward trend. It's barely downward. I think eyeball, it's very hard to see that. And we did have a surge in early June. I'll talk about that in a second, why I think our cases went up there. But we are concerned, as the governor mentioned, we are concerned that we may see more cases. And part of that is due to good news, which is that our testing has gone up dramatically. You may have noticed on the website, for those of you that follow it, that our number of tests jumped from 4,000 to 5,000 per week up to 10,000 in the last week of May. We think that's one reason why our case counts went up. We are simply testing more people. And that is, we knew that could happen, and so that is one reason why we have a second measure to look at the widespread, how widespread is the disease, which is the percent positive tests. So you can see there that the percent of tests that are being done out there, the percent positivity has actually been falling, which is a good sign. Partly, I think we are testing more people who are asymptomatic, which is what one of the recommendations is from public health and national leaders, is that we should be testing people, screening people, for example, going into work, maybe going into healthcare, that type of thing. So we think this is a good reflection of more testing going on, and it is somewhat reassuring that we don't have a lot of disease out there that we are not detecting. We still have a ways to go with testing. We'd like to see at least 10,000 a week continue. We are trying to meet the federal goal of testing 2% of our population per month. So we're headed in that direction, so we see that as a good sign. The next area we look at is what we call syndromic criteria. So this is looking at the reason we talk about syndrome is these are people that are showing up in emergency departments, and we don't know for sure they have COVID, but they have an illness that is what we call COVID-like. And we're doing that because sometimes delay in testing, test results may take several days, and we're trying to get a more real-time picture of what's going on in our emergency departments. So this reflects not only people who might be seriously ill with COVID, which is very concerning, but also burden on our healthcare system. How many people are being seen in the emergency department? And then the lower graph looks at how many people are actually admitted to the hospital from the emergency department. And you can see there reassuringly that we are seeing a downward trend, not a very strong one, though. We'd love to see that even farther as far as people coming in with that illness. Again, we can't say from this graph how many of those people actually have COVID, but we know that influenza, for example, is decreasing throughout the state. Other respiratory viruses are decreasing. So we think this is probably a fair picture of illnesses that in many cases might be COVID. Our third area, our last area that we look at, is healthcare burden of the inpatient situation. How are hospitals doing? And we continue to see good availability of ventilators and intensive care unit beds, as you can see in the chart there. You'll notice a slight drift downward in availability of ventilators and intensive care unit beds. And talking with the hospitals, that is not due to more people being admitted or being in the hospital with COVID. They actually have very few patients right now in the hospital with COVID. But these are people that they've started to do elective surgeries, that some of these people require short intensive care unit care after their procedures. And that is why we're seeing a little bit of a downward drift. So we are not concerned about that from the standpoint of that representing an increase in severe COVID cases. And then you can see on the bottom of that page, we have at least a 10-day supply of personal protective equipment for those hospital workers as of our latest snapshot on June 9th. Lastly, I'll talk about our healthcare workers, and this is another area that we felt that we really are a little bit concerned at some of what we were seeing. We saw an increase in healthcare workers reported. Remember that healthcare workers include anybody that works at those facilities, so it could be janitorial staff, it could be a nurse, it could be a physician. It's all sorts of people that work in these settings. When we looked at that data more carefully in early June, remember this coincides with our bump in testing, a lot of that testing happening by hospitals of their workers. We found that this is not one particular part of the state or one facility. This is really scattered throughout the state, and in many cases what the investigators found was that these were actually healthcare workers that had actually appeared to have gotten the infection not at work but in the community from a household member or other community spread. So even though we keep a close eye on this, just keep in mind that healthcare workers getting infected does not mean they were infected on the job. Nonetheless, this is a trend we're worried about there, and you can see there that last criteria we had there, we would like to see fewer than 2 healthcare workers per day reported, and we actually would not have met, if that was our only criteria, we would not have met it because we exactly had 2 per day on average, so we can't consider that less than 2. So that's our metrics. As the governor mentioned, we feel like we kind of squeaked under on this one, and so I just want to second what the governor said, that we are concerned. We urge people to remember that to keep our economy open, we all need to do our part. The disease is still here. It is still circulating in the state. It's nice to see everybody out there with a mask on. We really appreciate it. And we urge people to continue to physically distance from each other and to wear face coverings. Thank you.